Hi, it's Loren Lockman, coming to you from the Tanglewood Wellness Center in Costa Rica, and I've been asked this morning to talk a little bit about pain. We've been having a discussion here about why we experience what we do and what these things are for, and how frequently these things are misunderstood, and most people simply attempt to avoid things like pain. But let's look at pain in particular. Why do we experience pain? Well, first of all, pain is often there as a warning. So, for instance, how many people here have broken a bone, or torn a muscle, or sprained an ankle? And when you attempt to use the affected body part, what do you experience? Well, you experience pain. The pain is there to tell you to stay off of it. So, but you know, it's common today. Look at professional sports. You got a star, pro football player. They injure their knee, whatever it is. What do? They wrap it up. They inject it with painkillers, and they put them back on the field.
Wow.
Well, no pain. I can play, right? But think about this. The pain was there to tell you to stay off of the knee, because the knee needs to be stayed off of if it's going to heal. Right? The pain indicates that there's been an injury, there's been a problem. If you keep using it, you may not feel the pain because you've used drugs to prevent your brain from getting that message. But if you don't feel the pain, you're only likely to do far more damage. Okay, this doesn't make any sense. So, I was talking with somebody recently, just the other day, might have been one of our other guests who's not here right now, but about pain. And in the last half a dozen years or so, I have broken 2 ribs. I have broken my right knee and the top of my left tibia. I've broken 2 fingers. I've been bitten by the most poisonous snake in Panama. And I have other various and sundry minor issues like scorpion bites, which aren't really that big of a deal. Stings, I should say. But with all of the other more serious injuries, I mean, it's been now, 20 years plus since I've taken medications of any kind. No painkillers of any kind. Even though I was in a significant amount of pain in some of those instances. Why didn't I use something to feel better? Well, because I understand that the message, the pain message itself, is useful to me because it ensures that I leave that thing alone. Okay? If I'd taken a pain medication, in fact, the most recent time I did mention was when I was holding Diablo, the kitty, a few months ago. He had a serious infection. The doctor told me he might die without antibiotics. He needed an injection. I'm holding the cat. It was very painful for the cat, and the cat wanted to get down, and he bit down on my finger as hard as he possibly could. This cat, in a year, then almost a year, he's been with me since he was 6 weeks old. He's never tried to hurt me. We play rough, but he never hurts me. But he punctured my skin in 5 places and drew blood. And cat's teeth aren't the most clean things in the world. By the end of the day, my little finger was much bigger than my thumb. It swelled up so much. And it so much so that touching anything with my right hand was painful, anywhere in my hand. It happened to be a Wednesday, and I needed to roll the TV out and back in. And it was very hard to use. I mean, I was trying to push with the heel of my hand, because if I came anywhere up closer, it really hurt. So I was trying to, it was a kind of an awkward thing to try to use that part of my hand to push the TV cart. So part of it was I wanted to avoid not feeling those feelings, because I know that the pain is there to ensure that I leave it alone. The drugs also may interfere, depending on the drugs, with the actual healing process. Okay? Not to mention that, again, if we're not feeling pain, we might be doing more damage to it. So what other messages that's probably the primary message that pain gives us. I mean, there may be other messages. I jokingly said, before we started this, Yeah, it's pain is your body telling you, dumbass, don't do that again. And to a certain extent, that's true. I mean, you had an injury, something happened with your arm the other day.
Yeah.
And I said to you, don't use that arm anymore than you have to.
Yeah.
Right? Because when you used it, there was every once in a while you'd have more pain. So your body is telling you, okay, don't do that thing, whatever it was. Sometimes we're using our body in ways that may not be such a good idea for us. Maybe we're not flexible enough, maybe we're not strong enough. Whatever's going on, that pain that may occur is telling us that that's something we shouldn't be doing. So what other uses might pain have? Other ways pain can be useful to us? Anybody have any ideas?
Really?
Because that's all I've got right now. Thought I might have more to say, I guess not.
No, I was just thinking of something, that popped into my head, the anti-swelling, what takes swelling down?
Right, well, thank you, that's a good point. We could enlarge this a little bit beyond pain, but I mean, that's a good point. We have somebody here who, for the last 4 days or so, her face has been, the right side of her face has been roughly twice the size it normally is. And, she was in a tremendous amount of pain. And pain, by the way, it's not something that's really so objective, how painful something is, because we all experience it differently. But she was experiencing it in a way that was painful enough that she really didn't want to experience anymore. To the extent that she said, I want to break my fast. And we talked about it. She agreed that it made more sense not to. But one of the things I was willing to do that I typically don't do, in fact, this came up weeks ago with someone else who's no longer with us, who came and fasted and went home. But there was some swelling or some pain and a request for ice. And I said, no, we don't want to do that, because the swelling is there for a reason. Even though it's painful, the swelling happens because your body is bringing blood, bringing lymph. In the case of a lymph node, which this particular person was dealing with, the swelling is there because the lymph node is congested as the body is cleansing. But all we could do would be to treat a symptom. We could take the swelling down with ice, but what do we do if we're doing that?
Will you interfere with the body's
We're interfering with the body's healing process. And who knows best what the body needs to do? Well, the body does. The body is virtually infinitely intelligent. So we're not going to improve things. If I twist my ankle, fortunately it doesn't happen like it used to. If I twist my ankle, I do not ice it. I let it swell up, and I know that it may be uncomfortable now, but it's going to heal much faster than if I get in the way. And so, again, something I've said over and over again over the years is that the best we can do is to get out of the body's way. Every time we try to manipulate the body, we can make ourselves feel better, and that's what we're usually trying to do. Let's deal with the symptoms so we feel better now. But every single time we do that, the impact is that we interfere with the virtually infinitely intelligent body's healing process, and we don't heal as quickly as we would have. So, whether it's pain from swelling, or whether it's pain from a break, whatever it is, the best we can do really is to get out of the way, find ways to deal with it. So, you want to relax, because when you are not relaxed, if you're anxious about it or afraid, you tense up and you feel more pain, right? So Reiki is helpful. I remember a few years ago, actually at this point it's been probably 10 or 12 years ago, we had a client who twice over the course of her fast passed a kidney stone. And that's incredibly painful. She was attempting to, it was somewhere in the system, and she was in a lot of pain. And I put my hands on her and started giving her Reiki, and she instantly felt better. Okay? And just doing anything that allows somebody to relax is going to be helpful. We're not suppressing the pain. We're simply allowing the body to move into a more restful state or more relaxed state, and we're not going to feel that pain nearly as much. Now, if you do something, again, let's say it's a knee, and you're more relaxed and it doesn't hurt as much, you go to walk on it, you're going to feel the pain. it's not going to be reduced in any way, and that's a positive thing, because the last thing you want to be doing in that case is walking on the injured knee. So pain is our friend. It's there to send us a message, to let us know what does and doesn't work, and to remind us to get off of that injured part of the body, leave it alone as much as possible, and allow it to heal. So I hope that's helpful. I hope it's been useful, and I'll see you next time.